So sinus tachycardia, POTS is another form of tachycardia. There's a few different ones they have diagnosis for now. What's common is positionally, then your heart races. Usually gets some dizziness associated. And lots of times those patients that have that also have, lots of times you'll also have gut issues or some kind of acid reflux, many times chronic fatigue, anxiety, neck pain, or like a knot in your neck or a really tight neck. Those patients tend to respond really well with upper cervical chiropractic. And what happens is the head and neck positioning, it affects blood flow and CSF flow to and from the skull. It also causes a stretching of the vagus nerve and can cause a compression of the brainstem. And that can affect vertigo, blood pressure in the skull. So you can also have the autonomic effect on the heart rate. You have the vagus nerve going to the gut. And so you can get all these conditions. And these typically, I just had a patient and her doctor said, suck it up. Sorry, you're just going to have to deal with it. There's nothing that can be done. And a lot of these people do much, much better with upper cervical chiropractic. They don't always go back completely to normal and have a complete resolution. But I've seen many where they were able to lie on their back and then getting up and they got like a mild discomfort instead of just like they're going to fall over or they can't lay on their back at all. So I've just seen some people do much, much better. But if the problem's been there for years, lots of times you got to give it time. You got to get the body in alignment and you got to get it to hold to then allow that nervous system to heal and recalibrate. So if you're having POTS or another form of some kind of tachycardia and the doctors are saying there's nothing you can do, there is hope out there. I've talked to other upper cervical chiropractors. They have seen these patients do better, and some of them do a lot better. So there is hope. If you're struggling with POTS or another form of tachycardia, get x-rays with an upper cervical specific chiropractor. You're probably going to have to go through a few x-rays to get centered and get in alignment and get holding and get that pressure off of the brainstem, get that head centered, come back over. That vagus nerve will no longer be stretched. Blood flow, blood drainage from the skull can happen. CSF flow to and from the skull can now happen normally. And you got to get that muscle memory changed, get the body holding, and then many of them will do much, much better. So there's hope. If you're dealing with POTS or some other form of tachycardia, get checked by an upper cervical chiropractor. There is a chance they can help you.